Hello, my name is John Thurlow. I'm a physiotherapist working for the Somerset NHS Foundation Trust. And I'd like to talk about mechanical low back pain. I'm going to explain about the condition itself, the symptoms you may experience, and give you some ideas on how to manage these. The spine is a very strong structure, made up of 24 bones called vertebrae, which look like this. They have a disc of cartilage between each vertebral body, which are called discs. The spinal cord runs up through this channel here, with nerve roots coming out to the left and right at each vertebral level. The spine is held together by strong ligaments between each vertebra and up the length of the spine. Muscles surrounding the spine stabilize and move it, and there are joints at each level called facet joints, where the movement occurs. At the bottom, the vertebrae fuse to form the sacrum, which is joined to the pelvis, and below the sacrum is the coccyx, or tailbone. Mechanical low back pain is a very common condition. In fact, most people will experience at least one episode of mechanical low back pain at some point in their lives. Despite this, when it happens, it's not uncommon for people to feel fearful, confused, or have heard conflicting information about the best way to manage their pain and get back to the activities that are important to them. The way we understand mechanical low back pain has really changed over the last few decades. We now know that in most cases, although it's not possible to identify the exact cause of mechanical low back pain, most episodes get better within a few weeks. We also know that any kind of structural damage is rare. We also know that imaging from X-rays and MRIs look very much the same for people with and without back pain, and are rarely helpful in identifying the cause of pain. It's very common to find things like age-related changes in the spine in people who have no pain or functional limitation at all. Mechanical low back pain is pain that is linked to movement, position, or activity. For some people, this pain may spread into the buttocks and upper legs. We often hear people talking about feeling stiff or not moving as well. Mechanical back pain may flare and settle, sometimes in response to a change in activity or a sudden movement. People complain about different types of pain, from a grumbly, achy pain to more sharp, stabbing pains. Sometimes the nerves coming from the lumbar spine become irritated, causing pain and sometimes loss of power and sensory changes in the leg. We call this mechanical back pain with radicular leg pain, or what some people call sciatica. Our advice for managing this type of pain is generally the same as for mechanical low back pain, but there are some things you need to be aware of. The following symptoms are rare, but you should contact your doctor or physiotherapist as soon as possible if you experience any of them. Difficulty passing urine or having the sensation to pass water that is not there. Numbness, tingling in the genitals or buttock area. Loss of bladder or bowel control. Impaired sexual function, such as loss of sensation during intercourse. If you're experiencing pain that runs down the back of both legs. If you have noticed any alteration in sensation or loss of power in the legs. Feeling unwell with your back pain, such as fever or significant sweating that wakes you up from sleep. One of the most important things you can do with back pain is to keep moving and stay active. This can often feel counterintuitive, as the pain seems to be telling us to avoid this. Your physiotherapist can support you in recognizing movements that are safe and beneficial and can really help settle the symptoms down. Exercise has been shown to be the most helpful treatment for back pain. Interestingly, it doesn't matter what type of exercise you do, as long as you remain active. So it's important to choose something that you like doing and keep at it. Your physiotherapist may discuss with you other pain management tools, such as pacing your activities, using relaxation techniques, as well as helping you plan and set goals. We also know how people feel, and even worrying thoughts or fears can influence people's experience of pain. Those people with extreme fears or worries about their pain are more likely to go on and develop longer episodes of pain, and may avoid movement because of their pain. We tend to call this fear avoidance. This is something that your physiotherapist may explore with you, because we now know that people who experience fearful, anxious or worrying thoughts about their back pain, which lead them to avoiding activities, are more likely to experience longer lasting episodes of pain. The good news is that there are a number of helpful pain management skills which can help you in understanding your pain, pacing your activities, and giving you the knowledge, skills and confidence to return to the activities that are important to you. See the links below for further information. Pain medication may be helpful in a flare-up of back pain, and we recommend that you are proactive about this. Lots of people talk about having a high pain threshold or not wanting to mask their pain, but pain medication can allow you to feel more in control so that you can return to the activities that are important to you. It can also help in managing a pain flare and giving you the confidence to begin to move and increase activity. It's important to remember that research tells us that pain does not mean that you are doing any harm, and it's not a sign of damage either. For oral pain relief, you might want to consider over-the-counter options with your pharmacist. Sometimes discussing with your GP about further options if your pain is not settling, or if you're getting nerve-related leg pain, can be helpful. We also know that heat can give you some short-term relief and relax tight muscles, and most pharmacists sell microwavable heat bags that can be useful for this. Although traditionally used by physiotherapists, hands-on treatments have been shown to have only a small benefit to back pain, and only when used as part of a whole treatment program which includes exercise. They're certainly not a long-term solution. Recent evidence and guidelines also suggest that treatments such as traction, acupuncture, and various electrical treatments are not effective in the management of back pain. As I've mentioned, the most important thing you can do to increase your activity levels in a graded fashion. Backs benefit from movement, so if you're working in a sedentary job, make a point of getting up regularly and walking about every hour. If you feel stiff in the morning, try some gentle spinal movements as you lie down, such as tilting your pelvis or dropping your knees to each side before you get up. We know from evidence that there is no one type of exercise that is any better for back pain than any other. What matters is just that you move little and often. So if your activity levels are low, try to start with just a short walk or two in a day, and try to increase these levels gradually. Once again, remember that pain does not mean you're doing any harm. The NHS advice is for 150 minutes of moderate exercise each week. But we know for most people they won't manage this, but it's important that we're honest with ourselves about what's required to be healthy. If you aren't doing enough, don't be overwhelmed by this number. Just set yourself small, achievable goals to increase your activity week by week and month by month. Any increase you make will be good for your back and your overall health. We also know that being overweight can worsen your back pain, so staying active is important as long as trying to maintain a healthy weight. Of course, it's often hard to manage weight, especially if activity feels painful. There are a number of local services available which can help you with this. Ask your GP or your physiotherapist for advice if you need it. The NHS website has a fantastic free 12-week exercise and healthy eating weight loss plan that can help people of any size, age or ability.
Knee hugs. Laying on the floor, hug your left knee into the body. Hold for 20 to 30 seconds. Then repeat with the right. You can also hug both knees into the body together and hold, if able, for 20 to 30 seconds. If comfortable, you may want to repeat 2 to 3 times. Lumbar rotation. Laying on the floor with knees bent and feet flat and arms rested down by your side, Gently lower both legs together down to the right, then down to the left, in a gentle, relaxed movement for around 30 seconds. If comfortable, you may want to repeat this exercise 2 to 3 times. Pelvic tilt. Lying on the floor with your knees bent and feet flat, rest your arms down by your side. Tilt your pelvis by pulling your belly button in towards the spine, flattening the lower back into the floor. Then tilt the pelvis in the opposite direction, creating a gap between the lower back and the floor. Repeat 10 times. Hamstring stretch. Lying on the floor, bring your leg up towards you. Place your hands on the back of your leg above the knee and gently bring the leg towards you, holding up to 20 to 30 seconds. You should feel a stretch in the hamstrings at the back of the leg. Repeat with the other leg. You can reduce the intensity of the stretch by reducing the pull on the leg and keeping a slight bend in the opposite knee.
We hope you found this advice helpful. For further information and advice on low back pain, you may find it helpful to watch the back pain video that has been created by the Spinal Orthopaedic team. See the link below for details. And thank you for watching.